move about, it has a more natural type of motion to it. The surfaces roll and glide against each other, and as opposed to just bending one on the other. And those people who want to stay active, this is an excellent type of knee for them. And there's been studies that show that there is a 97% patient satisfaction of this particular knee. Now, rotation is important, and again, if you look at this, the plastic piece that goes on top, you see as you move your knee, you see it rotate a little bit, and that's what happens. It has a little bit of rotation, which is what you want. Now the question is, and I was talking to somebody before about what should you do, you know, how soon do you do this when you start getting symptoms? The earlier you get this done, once your knee is starting to deteriorate, the better off you will be in the future. The problem is that if you delay surgery, you might have, you might get further medical problems. And I was talking to a gentleman who, since he thought he'd have it, he was told he needed it years ago, but delayed it on the basis of what he was told, and since then he's developed some diabetes. So that's a problem in itself. The other thing is that when you are somewhat younger and your muscles are in better shape and you're more active, your replacement will work that much better and your rehabilitation will be that much faster. So you don't want to wait until you're like stuck in a wheelchair because the rehabilitation will be more difficult. And why not have the enjoyment of being able to use your knee all through those years? So that's why it's better to do it early. And there's been numerous articles that point out by many professors throughout the country that point out that the results of a replacement will be much better if you do it early once you develop arthritic changes in your knee. So what do you expect with or without a knee replacement? You have severe pain, you have inability to walk any distance at all, you have medications aren't helping, and your sleep is interrupted. So, if you have your knee replacement, you take 2 months of rehabilitation, and within 3 to 6 months you're back to all your activities you'd like to do. If you delay surgery, you have continued the 1 to 2 months, you're still having the same pain, and 3 to 6 months, you're still having the same pain, and your mobility keeps getting worse. So the women have seem to get more arthritis than men, and osteoarthritis affects 3 times more women than men, and they are severely disabled from this thing. It's also interesting that studies have shown that the women's knees rotate more than men's, especially during deep bending and kneeling. And this rotating platform type of knee that we're proposing is much more helpful in somebody who has to have an increased rotation and of their knee. There's thought that some manufacturers feel that there's a certain type of knee that's better for a woman or for a man. There's nothing that really shows us that is markedly significant at this point. And when we do a knee replacement, we have multiple sizes that apply to both women and to men. When I go in and do a knee replacement, I have a variety of about 25 to 30 different pieces that are different sizes that we, number one, we measure beforehand, and number two, at the table as we're doing it, we have the ability to change sizes or test the size that's exactly right for that particular person. So we're able to do that, current knee replacement patients have a 90 to 95% satisfaction rate with their surgery. The big discussion lately is minimally invasive surgery for the hip and knee, and I do a very small incision on hip replacements. On the knee, we now do a much smaller